was PTCSCS, correct?
Mm-hmm.
Okay. My jacket wants to crawl up.
And just normal speaking,
30
please.
seconds.
Yeah, just. Good evening and welcome to HealthLine on PBS39. I'm Mark Evans, and with me tonight on the topic of women's health and physical therapy is Margaret Bryden. She is a women's health physical therapist with Indiana Physical Therapy, and it's a pleasure to have you on the show tonight. And I noticed in your title that it's PTCSCS. I know the PT is physical therapist, correct?
Yes.
What's the CSCS?
Certified Strength and Conditioning Specialist.
Okay, which ties in very well with what we're going to be talking about tonight. What is a women's health physical therapist? What do they do?
Women's health physical therapists are physical therapists that have specialized training in women's health problems, such as pelvic floor disorders, incontinence, osteoporosis, lymphedema, various problems that women of all ages experience.
Okay, so some of these conditions or ailments that you might treat, you just mentioned a couple of those. Are these things that come through your door quite often?
Yes. I'm a specialist in pelvic floor physical therapy, so I primarily see pelvic pain and pelvic floor dysfunction, such as incontinence, come through my door. Probably 80 to 90% of my patient load is that population.
Well, what is incontinence? I mean, let's just be frank and let's talk about that. I'm sure that our viewers are really interested in this subject.
Yes, incontinence is basically the loss of control and where they lose either urine or feces due to pelvic floor muscle weakness or bladder spasms.
I see. And there's more than one, obviously, and how many in total different types of incontinences?
The usual type of incontinence that we're talking about when we deal with that, there's stress incontinence. That's when you have weak pelvic floor, and when you do things like cough, sneeze, laugh, jump, that pressure on the pelvic floor causes leakage.
Okay.
Urge incontinence is when your bladder actually goes into spasms and it's overactive, and that is typically when the person describes a strong urgency. Maybe they're going every half hour, or they put a key in the door and then they leak.
I see. And how many Americans experience this problem?
Oh, it's a significant amount of Americans. About somewhere around 20 million Americans experience incontinence of some sort, and also it's very prevalent in women. 30 to 45% of women, as they reach the age of 45, have experienced some sort of incontinence.
So the average age of having the incontinence problems would be in the middle age, 45 age mark. And we were discussing pelvic pain as well just a few seconds ago. What types of pelvic pain do you happen to deal with?
Pelvic pain can be varied. A lot of times people think about pain and pelvic pain as just pain in their low back, or during pregnancy, a lot of women will have pain in sort of their low back and pelvis region. We definitely deal with that type of pelvic pain, but there's also other types of pelvic pain, like pain during intercourse, pain after episiotomies, pain after other gynecological surgeries, and pain that basically interferes with activities such as intercourse or even having a gynecological exam.
So we're going to talk about some of the repercussions physically about some of the issues you just discussed, but there are certainly some psychological issues, and I know that's not your area of expertise, but I'm sure you have to deal with that in your line of work. What are some of the psychological repercussions of these two disorders, the pelvic pain as well as the incontinence that a woman might experience?
It's significant. When a woman has pelvic pain, her communication with her partner can be affected. She may feel insecure about herself. There's just so many aspects of the pelvic pain that affect her life. When a woman has incontinence, again, they're dealing with perhaps wearing pads, perhaps limiting where they can go. Some women choose not to do things like run, and then they may also then gain weight because it was something that they enjoyed before. So it can have a significant impact on quality of life.
I understand. We are asking and encouraging our viewers to call in with questions, and the number is on the screen. And we have Patty who has a question. Patty, are you able to hear us? She don't have Patty at this moment, but we'll get back with her in just a second. We'll go ahead and move on.
Hello?
Yes, hi Patty.
Yes.
Would you like to ask Margaret a question?
Yes, I do. I have a question about lymphedema.
Okay.
I have a very serious problem in my right leg stemming from surgery due to flesh-eating bacteria. And I have a blood flow return problem and severe nerve damage, and my right ankle swells to the point I can't even wear my shoes. They did do the testing about the blood flow return problem, and even when I see doctors, they are always commenting that my ankle is so swollen, and it's extremely painful. Sometimes it feels like there's thousands of ants biting it, and it swells incredibly if I'm on it at all.
Right.
And I don't know who to see to maybe help this problem, or if there's something I can do. I've tried elevating it. I've tried icing it. I'm at wit's end.
Yes. Have you gone to physical therapy for lymphedema, for bandaging?
No, I haven't. I wasn't aware.
Yeah, that's what I would suggest. Talk to your doctor and ask him to refer you to a lymphedema physical therapist, and they would be happy to do that. And there's definitely a lot that you can do with respect to bandaging and garments, and there's plenty of things to do for your condition.
Well, I know I did have, try the TED hose.
I probably need a little bit something stronger.
Okay, because what it did with that then, it was make my feet so numb I couldn't walk.
Yes, yeah. I think you need specialized physical therapy for that. So I think
and they would know who, because I've asked them several times, do I need to see a neurologist? Because my thigh, the nerve damage on my thigh goes, on a good day, it feels like I have a sunburn and I'm rubbing sandpaper on it. On a bad day, it feels like someone's trying to tear the flesh off of my thigh. Or pants. It's nuts.
Yeah, let your doctor know that you saw this program, and he or she will be able to give you a proper lymphedema therapist.
Great. Great. Thank you so much.
Thank you, Patty.
Bye-bye.
Bye.
While we're talking about that, the various physical therapy treatments, specifically for incontinence and pelvic pain, are there several of them? I mean, can you talk a little bit about that? Because what we want to do is we want to dampen the fear of any woman watching who has these problems so that they can get some medical help. And get the right medical help as well.
Absolutely. The physical therapy treatment for pelvic disorders, not exactly what Patty was discussing, but the type of disorders that I treat a lot of. It starts with a thorough evaluation by the physical therapist. I'm a regular physical therapist. I'll look at the back, I'll look at the joints of the pelvis, we'll look at how the person moves, and I will get a full subjective questionnaire and find out what the problem is and how they're dealing with it.
Okay.
From that point, then I go ahead and do an internal exam, like a gynecological exam, where we're basically assessing the strength, the coordination, the endurance of the muscles. We assess for areas of tenderness and pain, and then that correlates with all the subjective measures that we have. From there, then we can set a treatment plan in place that's very unique and individualized for that patient, and with their goals and with what their problems are with specific to the pelvic floor.
Well, I'm sure this question is going to pop up, but can someone actually go to you without seeing their doctor first? I mean, or are they just able to contact you and say, I've got a problem, I'm going to come in, or do they need to see the doctor first, and how important is that?
In Indiana, they have to see the doctor first. Physical therapists do not have direct access in Indiana as of yet, so that is something that the physical therapy in many states, 43 of the states have direct access, but here in Indiana you do need a doctor's referral.
Okay, and some states do allow that otherwise?
43.
Oh wow, I didn't know that. Well, let's talk about some of the other conditions that you might be treating. Since Patty had something unusual, we might as well talk about that a little bit, and that might even spark some other questions from our audience.
Okay. Basically, there's plenty of other conditions that women's health therapists deal with, as I do as well. Pregnancy, we'll deal with pain during pregnancy. Some of the things may be low back pain, perhaps carpal tunnel syndrome, where they get some swelling through their wrists, neck pain. A lot of times they'll get swelling through their neck area, and that will cause some compression and cause possibly numbness or tingling down into their arms. The strain of the pregnancy itself. Certainly some of those pregnant women will also experience incontinence, and we will deal with that, although we will not do an internal examination on a pregnant woman. We'll do problems such as lymphedema of the arms or legs, and I'm not a particular lymphedema specialist, but we have several in this city who are excellent. And that is something that a lot of times women will look for after breast cancer or after a mastectomy. That would be the case for them. Regular orthopedic problems, certainly that are specific to women.
Right.
Some women prefer to go to a woman therapist because they have these other issues as well, kind of complicating the situation. Or they've had several things where they have both the incontinence as well as perhaps a hip replacement, something like that.
And just like anything else, and specifically talking about the pelvic pain and also the incontinence, wouldn't it be wise for someone, as soon as they had these problems, to get these things checked out rather than let them go on for years and years and years? I mean, is there a difference in treatment and length of time to treat?
Absolutely. And I encourage, when I work with the young pregnant women, I encourage them. I tell them many things. I say, when you're done having your babies, it is not normal to be incontinent. It is not normal to have pain during intercourse or have pelvic pain. And I explain to them that if they do, they need to see their doctor. This is not something they just have to live with. That's extremely important for women to start taking control of our lives and be able to direct our health care.
That is so true. So true. Well, we do have another caller. It looks like Linda has a question for you. Linda, would you like to ask Margaret a question?
Yes, I would like to know if magnesium would help for incontinence.
Linda, I'm not particularly sure of that, if magnesium will help or not. You can certainly ask your doctor about that. Are you having incontinence?
Yes, very severe.
Okay. Have you tried physical therapy?
No, I haven't.
I think that would be something. How many years have you had the problem?
Oh, about 2.
2 years?
Right.
Approximately how old are you, if you don't mind me asking?
I'm in my 90s.
Okay. I've definitely treated women of your age group, and that's something that you definitely possibly have some weak leg muscles, possibly some weak muscles in your trunk, as well as some weak pelvic floor muscles, and doing certain exercises will help you significantly.
Wonderful. I'll be glad to do those.
Great.
Be sure to speak to your doctor about that, Linda.
Thank you.
You're welcome.
You're welcome. Thanks for calling. Jan, we have a question from you. Go ahead.
Yes, I just got done having physical therapy on my back, and I keep having problems with my pelvic. They're putting my pelvic back in place all the time. I'm still having problems. My back's still hurting.
Okay.
And I have exercises, but I have problems getting my pelvic. They show me how to put it back, but I have problems getting it back in place.
Right.
And are there any ways I can do that with, or how I can do it?
It's difficult for me to answer that question without seeing you. I imagine what you're talking about is that you're having some joint problems in your low back, and they taught you some techniques in order to help yourself with that problem. Is that correct?
Yes, that's right.
Follow the exercises. If you have any questions, you should return back or at least phone your physical therapist and have them re-show you those exercises, because it's very important that you get that so that you don't have this problem recur. The other thing that you're probably going to want to do is to strengthen your abdominal muscles, and your therapist probably gave you some exercises for that too.
Yeah, they did.
Yep, and you need to really be strong and adhere to those exercises pretty much for life.
All right. Thank you very much.
You're welcome.
Bye.
Thank you, Jan. Well, as we talk about this, and we also realize that we have a lot of baby boomers who are getting older, and this is obviously going to be a problem for some of us, in fact, quite a fraction of them. And again, we want to stress that as soon as they detect any of these problems, to get them checked out and taken care of as soon as possible, because they don't have to suffer. They don't have to go on with this.
No. And in fact, one of the very common problems with baby boomers, and especially women who have had a number of children, is pelvic organ prolapse. And that's where possibly their uterus, their bladder, and their rectum, one or all three or a combination, will bulge out. And one of the things that women feel is they have difficulty going to the bathroom, or they're leaking, or they'll feel a bulge if they're standing for a long period of time during the day. Sometimes, if it's caught really early on, physical therapy can help strengthen the pelvic floor muscles, which will help prevent that worsening and certainly delay surgery. I work an awful lot with obstetric doctors here in the city, pre and post-op. When they do have to go to the point of bladder surgery, we can help strengthen the muscles before surgery and then strengthen them afterwards, just like you would with a total knee when you do your exercises before and after. So it's the same set of muscles, and it just helps the outcome immensely.
You said something earlier in discussion that women who have had children, and correct me if I'm wrong, are they more prone to have some of these problems more than women who don't have children?
Typically, yes. And the more children you have, the more likely you're going to have some weakness, because obviously delivering a baby vaginally will stretch out the pelvic floor at least 3 times the size. So it's very important for them, just as it's as important it is for them to get their abdominal muscles back after having a baby, they need to get their pelvic floor muscles back after having a baby.
What about some of these other conditions? Are they inherited? Can they be inherited? Or is this more of a body stress thing and things that they've done with their bodies throughout their life? Or can this be handed down from generation to generation?
Typically, it's a body stress, as you call it, thing. I mean, it's basically more your posture, what you've gone through with your life. It's not necessarily an inherited condition. Things that we can inherit, I suppose, if you want to call it that, would be things like maybe our personality or anxiety levels, or the way we deal with problems, and that can contribute to things like pelvic pain, the pain during intercourse, and some of the things that I would work on to help teach the woman to relax, stretch the pelvic floor muscles if they're unable to have intercourse because of pain. So if you're going to call that inherited, I would say more
genetic,
that.
Actually, probably more apropos. All right, well, let's go to the telephone again, and we have Dave, and he has some problems with apparently his knees, and not really sure about something. Go ahead and ask your question, Dave.
Well, I just have a question. I'm not sure if it relates to my hips or anything, but when I squat down and I try to stand back up, my knees do a lot of grinding, and it's hard for me to actually be able to stand back up. And I was just hoping maybe you had any knowledge of that or might know what's going on.
Okay, thank you. That's a very good question, Dave. And a lot of
relate
times
to women as well.
Absolutely, women can have this problem too. A lot of times, what that is a cause of is the kneecaps are not quite in the groove that where your bones are kind of, your kneecap kind of fits perfectly into a groove. It's kind of a V-shaped, and it fits perfectly into a groove. When you bend down, it kind of pops out of the groove. It could be related to muscle imbalances. So you might have some tight muscles on the outside, some weak muscles on the inside. So it's very, very important for you to get an evaluation so you know which muscles you need to strengthen and which muscles you need to stretch. And I'd really encourage you to find a physical therapist who can strengthen those muscles for you.
Thank you, Dave. Some of the symptoms that happen to come up is, and we're giving this again for women and their pelvic pain and incontinence, and some of these are going to be obvious, but what are some telltale symptoms that cannot be ignored that they actually need to see a doctor and eventually get physical therapy for the treatment?
For incontinence and pelvic pain?
Yeah.
If they leak when they cough, laugh, sneeze, jump, if they have increased urgency when they put a key in the door, or they have any, running water, they have urgency. If they're going to the bathroom more than every 2 hours, if they're going frequently. If they wake up in the middle of the night and they go 2 and 3 times with a normal water intake, that would be a sign. Frequent urinary tract infections, anything like that, those would be signs of the reasons to go for incontinence. And for pelvic pain, it would be obvious things like they're unable to have a gynecological exam without pain, they're unable to put a tampon without pain, they're unable to have intercourse without pain. Those would be certainly some examples of things for that.
Well, just for a little bit of levity on a very serious subject, what is it with the running water that makes people have that sense of urgency? What is? I never could figure that out.
You know, and I'm not sure either.
Okay,
but it's
one
a
of
cue.
those mysteries of science.
Well, it's a cue. It's just like the key in the door. I think what happens in, the Pavlov dogs, it's been a long time since Psychology 101, but it's just, when there's a cue that that there's a bathroom is within reach, sometimes that's when your bladder says, okay, I've done, and it goes ahead. And
I've always wondered about that. Several family members have had that problem. All right. Well, listen, while we have a little bit more time, I'd love to find out a little bit more about you, if you can give us a brief resume and your experience, because you obviously sound like you totally know what you're doing. So can you tell us a little bit about yourself?
Yes, I'm a physical therapist, and I've been a physical therapist since 1996. I went to school at University of Toronto in Canada. And over the last 4 or 5 years, I've started specializing in women's health. Prior to that, I've done all the physical therapy, the orthopedic physical therapy. I've worked in hospitals. I've worked in all sorts of different areas. But I've started to develop my skills in women's health. And over the past several years, I've gotten my specialization in pelvic physical therapy. I did my thesis way back when in osteoporosis. So I have a real affinity towards helping women with all their problems.
So you'd be a specialist in the physical therapy field of these particular problems?
Absolutely.
Okay, very good. You'd be a good one to talk to. No wonder we have you on the show tonight. We have Amy on the telephone. Amy, your question, please.
Hello, this is Amy.
Hi, Amy.
I wanted to ask about, I have a problem with pelvic organ prolapse. Not severe, but I'm wondering about a procedure that's done called a sling. Can you comment on that? Is it a surgery? Is that surgery?
Yes. Basically, what you've been told is probably from one of your doctors that there's a sling procedure, or perhaps someone else to help pelvic organ prolapse. Depending on how severe it is, and certainly you have to see your doctor for that, sometimes they decide that you need a sling, which is basically usually a piece of mesh or material to help lift the bladder up so that it doesn't fall out any longer. The thing is, Amy, it really is important to ask your doctor for a physical therapy examination, especially if it's mild, because the strength of your pelvic floor, whether you have the surgery or not, will help you immensely. And really, a lot of the weakness of your pelvic floor may be contributing to worsening your pelvic organ prolapse at this time.
Okay, Amy? Thank you very much. We'll go to another line here. Jan, we have you on the line. What would you like to ask?
Hello, this is Jan.
Hi, Jan.
Excuse me. I had cervical cancer 15 years ago, and I've been last year to 2 different urologists. They're in Fort Wayne, and they tell me nothing can be done. The scar tissue is so, there's just so much of it that it won't heal because I'm diabetic and stuff. Would physical therapy can do anything to help that? It's gotten so much worse the past year or two that I wear pads 24/7, and especially at night. Yeah, I just don't have the sensation. I just, when I stand up from sitting or stand up from the bed or anything, it's just happening to me right now.
Right. I really do. I would love to, take a look at you. I do very much believe that there's something that you can do. Will it get to be perfect? I'm not sure, but I do think that you can certainly get some help from the point that you're at. I mean, if you're wearing pads that often, I do think that there's something. If your doctor says there's a lot of scar tissue in there, I certainly I believe that, but I do think that there is some area of improvement, at least for your quality of life, that would help you. And I do believe that it is something. I have seen many cases that are similar to yours and have been able to help them.
Great. Is your name, address there? You're in Fort Wayne, right?
Yes.
Okay. It's just that they tell me that this has been happening now for years, practically ever since the radiation. They wanted to do a radical hysterectomy, but because the cancer was like stage 4, and because I have a bad heart, they couldn't do my cardiologist wouldn't let them do the hysterectomy. So I had 2 implants.
Oh my!
And that it's just gotten worse over the years, you know. And right now it's just almost beyond toleration.
I think it's something that would be worthwhile for you to try.
Okay. Thank you very much. Let's go to Lisa now. She has a question. Lisa?
Question I do. I am 36-year-old female. I am considered morbidly obese, and that might be a contributing factor. I just don't know. I have a problem with a leaking bladder. It doesn't matter what I do. Even if I fully into my bladder and I go to stand up, I'm still leaking at least an ounce of fluid. And I had 3 C-sections, and I noticed that it got more so when I had my last child. And I went to the doctor about it, and when they tried to put me on medication that would like dry up, not dry up, but like reduce the spasms go, I started having problems with muscle spasms and cramps, and to the point that my legs would just draw up. And I don't know what else to do, and I'm hoping that maybe you'll have some suggestions and or ideas to help, because I've tried, I feel like everything.
Yes. You have definitely a complicated case. With the multiple C-sections, I would want to be taking a look at what's going on with your abdomen and seeing if there's any painful spots on there. I do think that's probably contributing to it. Obviously, the weight is definitely contributing to the incontinence. We're not looking to solve all that in a day, of course, but that does contribute. But there still is some benefit that you can get from pelvic floor strengthening, looking at the other muscles, looking at trying to strengthen all your other muscles, as well as looking at that C-section.
All right. Thank you. I think we have time for one more call. I believe Jenny is on line 1. Jenny?
Yes.
Go ahead with your question.
Yes. Yes, I was wondering, I'm 45 years old, and I had 3 babies that were over 10 pounds. And about 3 years ago, I had prolapse surgery for rectum, bladder, cervix. I had a hysterectomy about 6-7 years ago, and they left the cervix, and that was definitely prolapsing. Everything was tied up with the surgery 3 years ago, but the cervix seems to be prolapsing again. Is there something I can do without having the surgery again?
And we just have a few seconds.
Yes, do your Kegels, go to physical therapy and do pelvic floor exercises. I would be happy to show you those. That will help you a lot.
Jenny, thank you so much for your call, and thank you for all the calls tonight, viewers. We truly appreciate it, and we hope that we answered some of your questions. We do want to talk about what's happening on Thursday. We have an Alzheimer's update, and of course we have it's elder health. That is our subject, and Dr. Cheng will join us along with Dr. Ann Moore. That comes up on Thursday at 7:30. And we appreciate you watching, and we really, truly appreciate you, Margaret Bryden, women's health physical therapist with Indiana Physical Therapy, for joining us in a very informative segment tonight. Thank you so much.
Thank you.
Thank you for watching. I'm Mark Evans on PBS 39.